Welcome to Ray Medics once again. Today, we'll be talking about a particular disease among women, as very common among women, of which has leads to death. Women dies of this disease every year. In fact, more than 300,000 of deaths were recorded every year from this particular disease. And what is this disease? You may be wondering, what is this disease? It's called cervical cancer. Cervical cancer. You must have heard about cervical cancer. You must have heard about this, that, what is cervical cancer. But you don't actually know what we mean by cervical cancer. Where can we find some? Where? What particular? Where in a woman we can find cervical cancer? What causes cervical cancer? The risk factors of getting cervical cancer, the prevention. That's what we'll be talking about today. So cervical cancer is a disease that affects the woman genitalia system, especially that is the cervix. The cervix among the woman genitalia system, because among the woman genitalia system we have got the uterus, the fallopian tube, uterus, then we have the cervix and the vagina. So cervix can be found in between the lower part of the uterus and the upper part of the vagina. That's when we found cervix. So, and this disease affects the cells of the cervix, which can cause the total cell death called apoptosis of cervix, or causes tissue damage or cell damage of the cervix called necrosis. And what are the causes of this disease? Actually, we don't know the particular thing that causes cancer, but it can be due to some risk factors. And what are risk factors? Risk factors is anything that increase the level of getting disease, that increase the higher chance of getting a disease. That's what I mean by risk factors. Among the risk factors, we're talking about the risk factors that can lead to getting cervical cancer among women. And what? Let me start from HPV infection, human papillomavirus infection. Human papillomavirus infection, in fact, is the most important risk factors of getting cervical cancer. And this disease, this infection, can be spread from one person to another. It can be spread through skin to skin contact, that is in one way. And it's also a sexual transmitted infection. This either being anal sex, either being oral sex, either being anus. So this says these infections can be transmitted through sexually. So we know that HPV is the most important risk factors of getting cervical cancer. Another thing we can still look about is sex history of women. The sex history. You may be wondering about sex history. Okay, what sex history? Sex history. The sex history is when a woman or a girl exposed to cell before the age of 18. Before the age of 18. That particular girl has high level of getting high risk factor of getting cervical cancer. Why? Because all the cells in its cervix at that particular age, they are very, very volatile, they are sensible to any kind of infections. So having sex, exposure to sex before the actual age, can cause high level, can cause cervical cancer. And another thing of sex history is having more than one partner. In fact, is among the most important things too. Because having more than one partner, because the carrier among this is men. When you have more than one partner, a man that has slept with woman with a girl infected with this virus or infected with this human papilloma virus infection, has picked this virus gently and sleep with another woman, because a man doesn't have service, so doesn't have the receptor cell of this human papilloma virus. But human papilloma virus can affect men too. Has picked virus, this viral disease. So this viral disease, when having sex with another lady in between some hours, so it can affect the lady without cervical cancer. So this thing continue to spread, like that. So having more than one sex partner can lead to high risk of getting cervical cancer. And another thing is smoking. Smoking, especially women that smokes, either being shisha, cannabis, cigarettes, anything, any tobacco form like, because there is one active ingredient in the tobacco called nicotine. So this nicotine reacts with the DNA cells of the cervix. They damage the DNA cells of the cervix, whereby can lead to high. And when the DNA cells of the cervix, so they will call what we call, it will cause what we call gene mutation. It will cause what we call gene mutation in the cervix, and causing the gene mutation, so it leads to what we call cervical cancer. So is not nicotine affects the cervix. Nicotine affects the DNA cells of the cervix, if it can cause mutation, thereby leading to cervical cancer. Another thing is having low immune system. When the immune system has been compromised, so we have high level of getting cervical cancer. Maybe having an underlying disease. Example is HIV infection, having an underlying disease which has reduced the capacity of its immune system. So it has reduced the capacity of the immune system. So still being infected with human papilloma virus, so it will lead to what we call cervical cancer directly. So it leads to what we call cervical cancer. And another thing is a chlamydia infection, is among the underlying infection too. This chlamydia infection affects women a lot. It's among sexual transmitted disease, sexual transmitted infection, affects women. So when we have chlamydia infection, we have AIDS. All these are risk factors of getting cervical cancer. I did not say the particular thing causes cervical cancer, but there are some risk factors that can lead to cervical cancer. But if I may ask myself, can cervical cancer be prevented? Can it be prevented? It's a good question. Well, cancer cannot be completely prevented, except we reduce the risk factors. If we reduce the high level of exposure, our high level of exposing to risk factors, so we at times we are trying to prevent ourselves from getting this disease, especially among women. So the risk factors, staying one, all the risk factors that I've made mention, if we can reduce of getting this risk factor, so at least we are preventing cervical cancer. Stable with a man, not having more than one sex partner. In fact, that's the main thing. Having more than one sex partner can lead to many things. fine. Some people may use a mechanical barrier like using condom and all, but what of true kissing? I've forgotten. An infection can be transmitted through kissing. You can be infected through kissing. You can contact me and ask more about this. So you can be infected through kissing. So when we reduce this eye level, when we reduce the eye level of this risk factor, so you preventing women, preventing yourself from getting cervical cancer. You're preventing yourself from getting cancer. And my former lecture, I said something that whenever when two persons want to marry, they should go for what we call marriage screening, pre-wedding screening. And among this pre-wedding screening, cervical cancer screening to detect whether someone has high level of this risk factor that can expose the person of getting cervical cancer. So we do marriage screening, so we do pre-wedding screening. So cervical cancer should be included among pre-wedding screening for a safer side, because many people, this disease causes death every year. More than 500,000 of women are dying of these diseases every year, of who we don't know the cause. You don't know the cause. So every women dies of diseases every year. So I would like us to follow the preventive measure I made mention, so that it will prevent us from getting the cervical cancer. You can share this lecture to everyone. Thanks for listening, and don't forget to subscribe. Thank you.